everyone. Welcome to Fearless Truth with Joey's Angels. I am Therese Hernandez, and today we will be talking with Amanda. Amanda lost her husband to hospital protocols, and she is going to share her story with us. Welcome, Amanda. Thank you so much for being here.
Thank you. So I guess it all started on, he reported having first symptoms on October 18th, which were just like, your mild symptoms, like, sinus issues, which, he'd had issues in the past with, his sinuses. So that's pretty much what it was. And that's what he thought it was. But then on the 20th is when he started having, the more severe symptoms like diarrhea and a fever. And then the next 2 days it got worse. So I went to the health department and got a COVID test, and he tested positive. So at that point, he isolated himself into, our bedroom. And then, that was on a Friday when he tested positive. And then come like Monday, Tuesday, we were starting to talk about, having him stop isolating, because he continued to say that every day he was feeling better, whether he was just telling me that or, being serious, I don't know. But so we talked about him coming down with the rest of us, and Wednesday morning he woke me up and said that he needed to go to the ER because he was having trouble breathing, and I could clearly see that. And I knew it was serious because he's never said that I need to go to the hospital in the 15 years we've been together. But before all that, we have 4 kids. So me and my 4 kids never got COVID during this time. We never had any symptoms ourselves. So I don't know.
Wow. So you were in the same house with him, and you and your kids never caught it from him.
Right.
Incredible.
And he didn't isolate until after he took the test. But I mean, he was sick for, 5 days before that, not very sick, but symptoms and then more severe symptoms. So yeah, I always thought that was odd. None of us ever even had symptoms, let alone needing to test for COVID. So I dropped him off at the ER, the front doors, and of course they said I couldn't come in. So then they take him back and did whatever they did. According to the medical records, I seen that they gave him the nasal oxygen. Well, I first should start by saying when I got there later on, they told me that he was breathing at 50% on room air. But when I texted my husband before they called me and allowed me to come in, he said his SpO2 level was 70. And that was, as soon as he knew something, he texted me that. And so eventually a nurse called me and said that I was able to come sit with him. So I drove right back there. When I got into the room, he just got back from getting a CAT scan done. But yeah, according to the medical records, he did have the nasal oxygen, but that only brought him up to so much. So then they gave him the BiPAP mask, and that's what he had on when I went in. And according to my chart at 7 a.m., which he went to the hospital around 5:30 in the morning, his oxygen level was at 92%, on the BiPAP. So it was, sustaining his oxygen needs. Well, a little while later, our hospital is like a Band-Aid station, so they can't handle anything. So they wanted to ship him out, and they wanted to life flight him to a bigger city that's about an hour away. And for whatever reason, life flight couldn't come because something with the weather. So then they decided that they were going to transport him by ambulance. And during this whole time, his oxygen levels were fine. So I didn't really understand the big rush, but, we, trusted what they were saying, that he needed to go
That's what we
somewhere
did.
else.
That's what we all did. We trusted.
Yeah. So after they told us that life flight wasn't coming, they said that he's going to be taken by ambulance and that he needed to be intubated now, or he's going to sign a do not resuscitate order. Because prior to this, they were wanting us to get him on the vent. And we just kept saying, no, no. And then when they came in and demanded, you either do this, or if something happens, you're a goner, basically.
Wow.
Of course, we were scared, and they said that being intubated was best for him, even though, his oxygen levels were still in the 90s. So he ended up getting well, before I left, I literally stayed there until they were literally about to intubate him. I seen them prepping him, getting him all the drugs in the system. And then literally they made me leave right before, they put the tubes on. I had no clue that was going to be the last time my husband was conscious. Never in a million years did I think, one, that he would be even the first one out of all of us to get COVID, because he didn't do, he wasn't always around a lot of people. He just worked, but he worked individually. So yeah, it made no sense.
I'm so sorry. And how old are your children?
We have 4 kids, 17, 13, 11, and 7.
Oh,
And I should say that he was 34.
my God, he was so young.
Yeah, he didn't have any comorbidities except for he was overweight. So after they transferred him to the other hospital, nobody ever contacted me, that he was there. I ended up having to call them, and yeah, if it wasn't for my chart, I would know nothing. They never, it was hard to get any answers out of them. They were very vague. It's always like they were hiding something, or that's how I felt.
Yeah.
But they
And
did.
I'm sorry, you received all his records, correct? You have all his records? So you think?
Well, see, this is it's so crazy. When he did pass away, that's when, and things that they said, and I asked, that's when I started saying, whoa, there's something wrong here. And then, so that's when I started questioning. So then I requested his medical records literally the day after he died, because they locked me out of my chart. I was within a few hours of him dying, I was not able to access that. And I called, and they said that's just what they do when a patient dies. Their account, deactivates. So I requested his records, and I got them without a problem. And at this point, I didn't have, no death certificate or anything, because he literally just passed away a day or two before. So within a couple weeks, I got the records, and he was in the hospital for 19 days, and I only got, I think, 3,500 pages.
Oh, wow.
and there's just a lot of stuff missing, I thought. And then I requested them again, but this time I used that one paper that somebody put out there that attorney said, this is our right to have the records, like kind of scare them or whatever, to let them know I know they have to do this. So then they sent me a denial letter and said that I had to go and prove that I was his whatever, I can't even remember, like his estate and probate. And I'm like, well, he didn't have any of that. He was 34 years old. And even though the death certificate, clearly states that I'm his wife. So they denied it. And then I put another request in, same thing, but without that paper. And I got some more records. This time I had them print them. The first time I got them like on a certified email or whatever. And then this time I had them print them, and I think there was just over 1,000 pages. I haven't had time to like compare the two to see if something's missing. But mostly what I found is there was one day that in the records they just sent me there was like nothing there for that day, but I haven't researched it yet. But so I got those records, and then I just placed another request, and they denied me again. So I haven't went farther, but there's just things in there. There's like hardly any like notes. Like there's definitely really none from the nurses.
Yeah.
The doctor.
Now he had 5 days of remdesivir?
No.
Oh, he didn't.
No, my husband got, and it's called Actimera, but
Okay.
it's called Tobel's something, starts with a T.
Okay. I know what medication you're talking about because I believe my dad got it also. I just can't pronounce it.
Right, it's hard. I just say Actimera.
Yeah.
And of course, there was no consent giving. I looked into that drug, and it's just horrible. I know everybody says remdesivir, that's the killer, but this is
There's many of them. I think there's many drugs. There's remdesivir, there's arsenibib. I don't even know if I'm saying that correctly. There's the one your husband was given. There's so many. And then when they combine them with everything on top of all the sedatives that they give them, it's just over medicating and over oxygenating. It's awful.
Yeah. But yeah, I would never even see how they would recommend the particular Actimera, because it clearly states on there, do not give somebody who, has an infection or is at risk for an infection. And it's like, hello, you just forced a tube down his throat. Of course when you have a vent, you're just asking for an infection because you're open. Yeah, so he was there. They would not let me in until the 14th day. I fought so hard. I talked to every nurse. Every nurse would tell me something different. I tried to get the nurses to have the infectious disease doctor call, because ultimately they're the ones who decide when you're out of isolation. Never got a call. I finally was allowed in on day 14, and that was actually 3 days early than what I was supposed to, because I just wanted a date, I knew when I could go. But they ended up lifting his restriction 3 days earlier, which I really don't know why. I don't know if it was because he was really sick, or I did ask a nurse, like one of the nurses that I actually liked, and she said, because of you. I'm like, what do you mean? She was like, because you kept fighting. So I'm not sure what to believe, but I would like to believe it's because I pushed the issue. But when I first went there, the doctor came in and I talked to him and I'm like, there has to be like another treatment. There has to be something else. So then he offered to do this procedure. It's called bronchoscopy,
Okay.
where they stick a suction thing and a camera and to all your parts of your lung to suck out whatever's in there. And he said we could do that. And this paper was the only paper that I signed the whole time my husband was in there, is for them to do this one procedure. And like I said, he was there 14 days before I got there. So why on the day that I'm there requesting better treatment, more treatment, we can do this. Okay, why didn't you think about doing that 14 days ago?
Exactly. And that's the key point, is to make sure you have someone there. I mean, we know this now. We didn't know this then. That's the key point. You were there, so they offered other plans,
Yeah.
other treatment plans.
And that was the only thing that they offered. After that, they just kept saying, we're doing everything we can. He's maximum therapy. I even researched all night, the one night, of all these different electronic journals, so they were reputable journals of things that COVID patients have taken and what can work and not work. And so I provided him with a front and back paper of all these different treatments that could work or couldn't work. I didn't know, besides what I read in the article. And he just kept going, no, down the paper, no. And then he didn't even look at the backside. And that's when he said he's on maximum therapy and he has a 30% chance of survival. And this was he died on the 19th day, and this probably took place on like the 16th day. And I should back up to when we did go to the hospital in our hometown. When I got there, she was asking about, when he tested positive for COVID, and I told her they never gave him a COVID test at the first hospital. And I specifically asked her, I said, well, how do you know that he's COVID positive? Well, because he told us that he was. I'm like, so you're just going to take their word? I mean, because one, I knew the tests are like not reliable. There's false positives all the time. So I just wanted hard proof, and they just said, we're going to take his word. So, they started the protocol before they even really knew if he had COVID.
Oh my God.
So, of course, while he's there, he gets all kinds of other issues. I should back up. When he arrived at the first hospital and got, blood tests right away, his blood glucose was 408.
Wow.
So this was before, any kind of meds were given, or, this was him coming straight in. And so we didn't know that he had diabetes, but they ended up saying that he did have them. They were never able to control his diabetes the whole time. Like they were maybe 5 times they were in the hundreds range. Everything else, I mean, it got almost to 600 at one point.
Wow.
I did a lot of research on like treatments, what you should do for someone who, he was later diagnosed to be in a diabetic keto acid. It's called DKA, which are pretty much same symptoms of what he went in the hospital with. And they didn't even, connect the dots or whatever. It was just simply COVID.
Yeah.
Yeah, they just never got his blood glucose in range. And I think it's because they didn't do the procedure or the protocol or whatever for someone being in diabetic keto acid. Like there's all these things that you're supposed to do. And I don't think they did like any of them. They weren't there, to treat that. They were just there to control COVID.
Of course, once they hear COVID, they treat COVID. They never treat the patient, and that's what they need to do. They need to treat the patients as an individual instead of treating COVID.
Right. That's what I always say to people when they like don't get it. I'm like, if somebody goes to the doctor and they have depression, I can guarantee you we can go in the same day. They're not going to give you the same pill that they give me. Why? Because we're different.
Exactly.
Our symptoms are different. Like, it's just crazy. It can never be a one size fits all. That's just not how it works.
Absolutely. That's the perfect way to put it. It can't be a one size fits all. And that's exactly what all these hospitals did, was just treat COVID instead of treating the person.
Yeah. And like, I've always been like a brain person. Like, I just love learning about our brains. And I knew him being all those drugs, like he was on fentanyl, propofol, midazolam, and Pretazex. He was on, sometimes they gave him Oxycontin. Sometimes they gave him Ativan.
My God.
What was the other one? And he was also on a paralytics the whole time that he was vented. Yeah. So oftentimes it wasn't uncommon for him to be on, 4 or 5 different sedation meds on top of the paralytic. And I knew, like, I even asked the nurse when I was there, I said, what are these medications doing to his brain? Because I could only imagine, I studied drug abuse and stuff on how it is on your brain. I just knew, like, it had to be fried. He's never done any drugs in his life, and here they're giving him everything under the sun. And you're not even, I've read so much stuff that you're not even supposed to combine opiates and benzoids.
Yep.
And then, of course, there's people that are on the ventilators and they're awake. They're just, I read that ventilators themselves are like not painful, they're just uncomfortable.
Yes.
Of course, they're painful at first because they're shoving that thing down you, but they don't need to be on all these pain meds, sedation meds. I mean, it just makes no sense. Like, being on all those meds, he had to be like dead. It's crazy to me.
Yeah. They put them into a state where they, they're not even like here. It's awful, awful, all the drugs that they pump him with.
Yeah, and then I was doing more research on all those drugs, the opiates and benzoids, and everything that was wrong with him, like, days into the hospital, was because of what they were doing to him. Like one of them is the midazolam. It can cause breathing problems, respiratory depression, apnea, agitation, cardiac arrhythmias, hypotension, and blood pressure or blood pulse, fast beat, heartbeat, or slow. And it's like all these meds pretty much do the same thing, cause all those issues. So then he started having low blood pressure. So they just gave him these horrible meds to control that, which led to other things. Then all of a sudden he has high blood pressure, then a million meds for that. And they just were never looking at what's causing the high blood pressure. So no, we're just going to fix it with another med. which I know it all comes back to the sedation cocktail.
Yep. I agree.
And then he did develop infections, pseudomonas. He ended up having that probably on the 10th day. And that is literally because of unsanitary conditions.
How awful.
It's passed, you know, from contaminated hands or surfaces or, you know, equipment. And that all had to be the nurses because I wasn't in there yet.
Exactly.
His room was never clean. Like I literally cleaned it when I got there and the days that I stayed there. Once I was able to see him, I was able to be there from 8 in the morning till 10 p.m., which was nice. But ultimately, I only seen him for 5 days. So on the 19th day, he was doing pretty good. He had blood pressure, high blood pressure, and he had a fast heartbeat. But none of his organs were shutting down. Like his numbers were, you know, his daily blood results, either they were a little low or they were a little high or, you know, they were normal. Like it wasn't like things were really shutting down in his body. So at that particular day, his vent settings was at 65. So, I mean, of course, he did need quite a bit of oxygen, but it wasn't like too horrible. When they start bringing people off the ventilator, I think she said between 40 and 50. And probably for the after the like second day, for probably almost 7 days, he was not even needing the ventilator, but it came all the way down to 45, and in those 7 days, it never went higher than 55. So it's like, I know for sure he didn't need it. Like somebody who needs a ventilator is probably going to need it at 100% for quite a while.
Yes.
And not once did they ever talk about a trach or, you know, anything like that. And he even, one of the nurses says, I've never seen somebody have this much progress so soon. But then on, I think it was November 9th, I don't know, something happened that day that just started things to go in a downward spiral. But back to day 19, the day that he died, like I said, you know, he wasn't literally on his deathbed at that point. And they kept proning him. So on and off, they would, you know, turn him to his stomach. And, but when it stopped, like, you know, having results, they stopped it. But at this point, they wanted to try it again. So this would have been the second day that they proned him while I was there. So the 3 male nurses came in and they said that they were going to put him on his belly, but then they noticed that he had a bowel movement. And so his head nurse asked me if I would step out while they change him or get him cleaned up and, you know, flip him. So I did, because I already had to go to the bathroom anyways, and I needed to make a phone call. So I stepped out of the room, went to the bathroom, and then I had to go down to the main lobby because the service was just horrible. So I made my phone call, and 6 minutes after they started CPR, a doctor decided to call me and tell me that my husband was coding. So I went in there. When I walked in the room, there was at least 10 different nurses, doctors, whatever they were. And I just stood at my husband's bed, the end of it, just in complete shock, like literally no emotion, because I just couldn't believe my eyes.
Do you think something happened in that room when you left?
When I left the room and they were turning him, they dislodged his tube.
Oh my God.
Um, so I have so many questions that are just not answered after I left the room. Like I feel like there are notes that I do have that are in his records are like contradicting each other. Um, and the one doctor say, well, that's not what happened. And I don't even know. It's just crazy. But anyways, once the tube was dislodged, it was found to be in his esophagus when they did do the gyroscope. So it definitely wasn't in the right spot. And so after him not getting oxygen for God knows how long, because I swear they were just standing there. Because, I have every minute, and sometimes I have several minutes on the records of, what his levels were. And his levels never went even up. They always went down, like his oxygen levels. And if you know somebody who's not getting oxygen and their levels going down, you would bag them until somebody could come back in and vent them. Well, how are they bagging him and his levels just continue to drop, not even a little bit creep up? Because then he was finally getting oxygen. So I just question the seconds and the minutes after, because it's crazy to me. But once once I got in the room, I sat there, I think it was like 17 minutes watching them do CPR. I seen nurses rotate back and forth. And every time they would check, there was no pulse or no heartbeat. I don't think they ever had a heartbeat since, it stopped. But I can remember this particular doctor that was right beside me as I was standing there. And he just said, we're going to have to stop soon. He's not coming back. He's been doing this for however long. Like, it's just not what I wanted to have here, right there in the moment.
Of course.
Doing CPR. But yeah, after he passed away, I had the nurse and the doctor come in and tell me what the hell happened. And his nurse admitted to dislodging his tube. Like I know that day was not the day that he was supposed to die. Like he still had, a fighting chance because he wasn't there yet, body organ wise. And, whether he would have survived the whole ordeal, I don't know, but that just wasn't his day to die. He died because of their negligence and them not protecting his airway, at all costs. And I know it's not easy to flip the patient, but they should be trained. And there was 3 males, so it wasn't like,
yeah, I know there's supposed to be
struggle.
respiratory therapist. When flipping them, there's supposed to be several different people in there.
Yeah, the respiratory therapist wasn't there because the nurse, after he seen that his numbers were dropping, he went and ran into another room to get the therapist.
Oh my God.
And that's documented. So
yeah.
Yeah, I don't know.
So awful. I'm so sorry. I'm so sorry you had to go through that. I'm sorry you had to watch it. I'm sorry you're still going through it every single day. I know it doesn't get easier, especially that you have 4 children and, now that you have to raise them on your own. It's not easy.
Yeah. And just to grieve, a loved one being missing is already so hard, but then to know that it was preventable, and it was definitely preventable, my husband.
Exactly.
It's like a whole new grief you got to go through. And every day doesn't get easier, it gets even worse, because especially when you read the records, I mean, I learn something every time I read them, that I didn't catch the last time. And when I started researching, the opiates and benzoids and sedation meds, it just all started clicking. Like, that's where it all started from.
And that's what everybody needs to do. Everybody needs to do their own research. People need to start waking up and doing their own research.
Yeah.
Because there's not many people out there that we can trust, unfortunately.
And it's so hard to even look at the records because I don't understand what half of it is. So I spend half the time just researching, what it is and what it means and all the different meds.
I know it's not easy at all. And I want you to know that I pray for you and your 4 children every day. You're in my prayers. Since I've read your story, breaks my heart. It does. And like you said, it's not, when someone dies a natural death, you learn to, you grieve their death and you can go on. But when someone dies like this, it's completely different. It's a different kind of grief.
Yeah. And then it makes it even harder when people don't believe you or they just think you're crazy. And then, it's so horrible.
Well, just
why would we make this stuff up?
Exactly. I know. I hear I'm crazy all the time. All the time. And you can't make this stuff up. The stuff that has happened and the stuff that's in the records, I say it all the time. You cannot make this stuff up. It's there. It's proof. But there are some people that will never believe, unfortunately.
And I can see that because like with COVID, like obviously, I mean, the whole time we knew that it was, set up or whatever, that it's just odd how everything happened. So I really didn't, like, I just ignored it basically. Why? Because I thought it was stupid and it didn't pertain to me. And my family never got it. So I never had, to deal with it. So I can see why people don't quite get it because it's hard to get when it hasn't affected you, and that goes with anything.
It's awful. Well, you just keep doing what you're doing and, letting people hear about it, whether they want to or not. That's all we can do, right?
Yeah.
That's all we can do. And I want to thank you so much for sharing your story here. And God bless you and God bless your children. I will continue to pray for all of you.
I appreciate that.
And I just want to say to everybody, if you have had a loved one die of COVID in the hospital and you think COVID is the cause of death, please get the records. Get the medical records and review them because chances are they died of protocol. Keep speaking truth fearlessly and we cannot stop. Thank you.
Thank you so much.